usually comes from the confused patients. They are in the Florence Nightingale era, and they just don't think there's such a thing as a male nurse. I had a woman tell me to get out of the room because I was impersonating a nurse, and she'd have me arrested.
When a man becomes a nurse, in gender terms, he has still descended the gender ladder. I mean, this is analogous to the fact that if you look at kids, girls can readily claim to be tomboys, whereas the male equivalent of a tomboy is a sissy. And who wants to be a sissy?
Go back to us being kids. Most boys, what are we playing? We're playing war, we're playing trucks, we're playing basketball, sports. Team-oriented activities, yes, but nothing where you're caring for a person. You're not candy striping at age 50, and like my wife and a lot of her friends did that. Men don't take care of dolls, don't play dress up. We don't babysit. In general, I mean, there's definitely exceptions. You come from a large family, and I didn't, but you come from a large family. The older kids, boy or girl, take care of the younger kids. I just believe that's how it works. So you get to care at a young age. I get that question a lot from patients, especially being a male. They always have that question: how did you get into nursing? And I probably started when I was a lifeguard, honestly. And we did a lot of CPR training and rescue training, and that got me into thinking that I might like the medical field. And in my freshman year of college, I decided on a nursing major because I thought it would be a challenge, and I thought I couldn't do it. And hopefully after this many years, I've proved that I can. But there's lots of different reasons that people get into nursing, but men seem specifically usually to have some unique reasons.
A lot of the things that male nurses gravitate to are less about caregiving. If you're a floor nurse, where you're kind of tending to patients on an everyday basis, versus being an ER nurse, where you're engaged in crisis management.
Working in critical care, there's a lot of men in our type of profession, our sub-skill, if you want to put it that way, in nursing and critical care. There's also a lot of men in the emergency department. There are a lot of male paramedics, ambulance workers, whereas you'll find less men in hospice or medical floors. And I think there's more thrill, there's more adrenaline rush for men in those sub-skills of nursing. So a lot of times their reasons for getting into it are to get that stimulation. I can think of guys who got into nursing, maybe they thought it was going to be exciting. It isn't, so they've taken a terrible approach to it, and they take a don't care approach, unless it's the patient that's bleeding and the blood pressure's in the tank, and you're putting in all sorts of lines. Unless it's that, they don't want to deal with it. They don't want to take care. And that means they just haven't learned from the people they've worked with. Caring is traditionally considered a feminine trait, and I believe it is, because men have a feminine side. And I think through being a nurse, a lot of us men have surprised ourselves that we really care, that this patient getting better, that this patient's family seeing their patient, their husband or brother or son get out of the hospital and be well, becomes as important to us as getting the paycheck. In fact, about 100 million times more important. Nursing has brought out this side of you that you're going to care no matter what. The feminine side is in every man, and it's just whether you embrace it in nursing and in life. And in essence, it's helped me be a better father to have that side. It's really prepared me for other roles in my life, being a nurse. So I'm thankful to even be in this profession and to discover my feminine side. I think if you had all male or all female nurses, you'd be missing out, because everyone brings something unique to the table personally, but also from their gender, they bring something. For instance, you've got a patient who's been in critical care for a couple months, and unfortunately they're very sick and they're not really going anywhere. They're alert. They haven't had a regular sleep schedule. They haven't been outside. They haven't had their hair done. Little things that a man might not think about in general. Now, I'm not saying that all men are like that, but you can generalize somewhat and say, since we didn't grow up taking care of dolls and babysitting, that we may not consider the little things. Well, a lot of times working with women, it's woken me and other male nurses up to, oh my God, yeah, this patient's really critically sick, but not so much that we can't arrange things to get them outside in the sun for an hour. That this is something that's very important to them. And women tend to focus on the details, which can be both a great benefit and a detriment at times. But usually it's going to be a great benefit. And men, we are very concrete. We like to get the job done. Sometimes we favor efficiency over thinking about things a little more. And sometimes our perspective is beneficial for the patient. Sometimes a woman's perspective is more beneficial for the patient.
There's a lot of different input that male nurses sometimes come across. Their thought process at times, they're able to sometimes understand patients in a little bit different way than a lot of female nurses. So I think the blend is very nice. I think we need to, for us to be able to change the image of nursing from being, a handmaiden or a female profession, that the more male nurses that we can actually get into the profession, I believe, and this is just my own thought process, is that media will change how we look at nursing. But I think that our salaries and possibly some of our other benefits will also improve when it becomes more of a male equalized profession.
I don't know if it's, the effect of ER or Scrubs or shows like that male nurses seem more normal. Maybe because the media, less than the actual change in proportions. I don't think there have been a major change in proportions in a while. In nursing, there's times when you're able to save people, and those seem few and far between because people these days are so sick, and by the time you see them, especially in the area that I usually work in, the critical care area, there's not a lot you can do many times, and unfortunately that's a reality that many people don't understand. But sometimes your deepest feelings and best stories come out of the patients that may not make it through. It's not the adrenaline rush of saving the patient or putting in the line or giving the blood products as fast as you can. It's the emotional stimulation you get from patients when they're so thankful for everything you've done. And they're not looking at you as a male nurse or as a female nurse, but as a caregiver.